Welcome to Nursing School Explained. In this video on the Next-Gen NCLEX and particularly the case studies that you're going to see on the exam. So in general, Next-Gen NCLEX will take effect April 1st, 2023, and the old NCLEX will go away. But there are many similarities, except that the new NCLEX now has case studies mixed in. So I wanted to take this opportunity and review what that means for your exam. So on the Next-Gen NCLEX, you will have a minimum of 85 questions, and the max will be 150 questions or 5 hours of time, whichever comes first. Out of the minimum of 85 questions, there are going to be 70 scored and 15 unscored, but you won't know which one those 15 unscored are. So that means these 15 unscored are test items that they are thinking about putting into the exam, that they have to run more data to analyze and see if they're fit to be on the exam. But again, you won't know which ones they are. And within these 85 questions, you're going to have a minimum of 3 case studies. And I say minimum here because each case study consists of 6 questions, and the case studies, you will see those all case studies within the first 85 questions. So knowing that we have 15 unscored questions and they have 6 questions each, if we multiply 6 by 2, that's 12. So you might have a total of 5 case studies. It is possible, although very unlikely. The case studies should not induce any kind of anxiety though, because you've been preparing, you've been going to clinical, you've been answering all your NCLEX practice questions, and you know what you're talking about. And I wanted to draw out some similarities here to kind of ease your mind. So out of the case studies, you will be given some data, which might be an HMP, some nurses' notes, some vital signs on admission and then current vital signs, some flow sheets, flow charts with I's and O's or other data that you have there, and then labs also. And then you have to be able to analyze what's going on with the patient. And the 6 questions that you see per case study are always going to be in the same order. So you're going to have to recognize some cues, be able to analyze these cues, prioritize any kind of hypotheses, generate solutions, take action, and evaluate the outcome. So this is a case scenario that kind of follows the patient in a certain care setting, and the case scenario kind of evolves as you're answering the questions. Know that you have to answer the question before you continue on to the next question, and that applies to the entire NCLEX exam. So you cannot skip a question and then come back later, because the case study question number 3 might actually help you answer question number 2. And you will not be able to proceed unless you make a choice. So you can't skip it, you can't leave it blank. You have to make a selection, and then the next question will come up. So if you don't for sure know the answer, just do your best, take your best guess, and move on rather than fretting and losing some valuable time. But within these 6 questions of each case study, I wanted to draw out the similarities to the nursing process. And I know that a lot of you go, oh my God, nursing process, I don't want to hear about it one more time. But it's just a nice way of thinking about what do we do. And the nursing process doesn't only apply to nursing, it applies to everyday life. Everything that we do, we kind of take in the data first, we analyze it, we prioritize it, we take some actions, and then we evaluate if it's worked for us. So the nursing process, a quick review: we do assessment, diagnosing on prioritization, we plan, we have our interventions, and then we evaluate the outcomes, and then we'll go back and we'll reassess. These 6 questions here are exactly the same. So the recognizing and analyzing the cues is your assessment. The prioritization is your diagnosis or your prioritization. The plan, generating solutions, you're going to come up with a plan. The taking action is your interventions, and the evaluating the outcomes is exactly that. So you've done this. You've done this for all of your nursing career in the nursing process, so you know what that means. You've done it in clinical, you've done it on exams, you've done it in in-class case studies. So this is nothing that's new to you. So please don't be nervous about it. You got these case studies. And then a recent seminar I attended about the Next-Gen NCLEX, the speaker here made a really good drawing that I particularly liked and wanted to share with you. So they compared the NCLEX as a pizza pie that's cut into all these different sections, because you're going to be seeing multiple choice questions, select all that apply, fill in the blanks, and so forth. So you have these sections. So for the Next-Gen NCLEX, it's the same pizza pie, the same sections, multiple choice, select all apply, fill in the blanks, and then you have these case studies, and these case studies are kind of the toppings that are sprinkled on top of this cheese pizza. So meaning that the base is the same, and then on top of it, you're going to have the opportunity to show all the knowledge that you've gained to be able to apply it to patient care scenarios that evolve over time and to analyze and see what's going on. So really, the bulk of the NCLEX is going to be the same, but now you have these 3 case studies on top. And again, they are what you've already known well through all of your nursing school. Just be able to apply it again and do plenty of practice questions to make sure that you are familiar with that type of format and to become comfortable with it, because the more questions that you practice, the better you get at it, just like with anything in life. So I hope this video has helped you ease maybe some of this test-taking anxiety for the Next-Gen NCLEX. April 1st, 2023 is right around the corner, and I know you got this. Prepare yourself well, and you will pass the NCLEX. Good luck, and I'll see you soon.